Hello everyone, my name is Megan. My name is Megan Enright. Maybe it's because I'm from Canberra that I was lost there for a while. I'm from the ACT, from Companion House. I'm not going to talk too much about our structure because I appreciate we're short of time, but in Companion House we are a little bit different to the normal structures for refugee health. So Companion House is a not-for-profit organisation service that provides care, medical care, counselling care and advocacy work for refugees and asylum seekers. We are funded by a small amount from ACT Health, some charitable donations and whatever I can generate as part of my role as business manager in the medical practice. So my role is team leader of the medical service. We run like a mainstream normal general practice. We have part-time GPs. Currently we have about 9 GPs that might only come in for 2 to 3 hours a week. So we manage the GP sessions. We have 2 practice nurses, of which I'm one of them, and we have admin staff. So we're a fairly small organisation, as can be reflected in the numbers that Sandy did earlier. We only receive a small number of refugees, new arrivals, but because we're a very small organisation, to me it feels like a lot. We have had a very busy year. I've been in this role as team leader for the last year, and it has been super busy. So when you know, I say around the traps at Companion House we've had 250 new arrivals, everyone's like, oh my God. Here it's like, what, 250? That's nothing. So we've had a few challenges, that's for sure. First of all, what's working? So we have just commenced, since I started in the role, nurse-led new arrival clinics. So the clients will come to see me, and we'll do I'll do an initial history, allergies, etc., and then they go on to have the second part of their assessment with the GP. So it works like if anyone comes from mainstream general practice, it works like a refugee healthcare assessment so that we can bill it as such. We're all about the billing, about Companion House, to try and maintain our sustainability. We also have the great advantage of being able to provide wraparound care for new clients that come in because we're small, because Canberra's small. If there is counselling that's required, then we can refer on within our own organisation in-house. And we can also do advocacy as well, especially with housing, which has been quite a big issue for us. We've got caseworkers within Companion House who can take on particular clients or families that are needing extra care and scaffolding. Our HSP provider is the Red Cross, and we have worked hard to have a good collaborative relationship with Red Cross. They're an organisation that is under stress. They have a high turnover of staff, but the team leader there has been consistent, and we've got really good direct communication with her, and that's been a huge advantage to the service. And a small thing, but we have very good access to Arabic interpreters. Most of our clients come from Syria and Iraq at the moment. That's probably about 80% of our new arrivals. So it's been incredibly advantageous to be able to access easily really good Arabic interpreters. Makes everyone's job so much easier. So the challenges, like lots of other people are expressing today, we've been seeing a lot more older clients and clients with chronic health issues that arrive to us quite unwell and have obviously been badly managed, and so they're needing quite a bit of follow-up and intensive clinical attention to try and improve things for them. And we're also noticing that there's high levels of anxiety and stress amongst the new Syrian community, and that's not to say clearly that new arrivals in the past haven't had this sort of difficulty, but our medical director Christine Phillips says that she feels this is the highest level of stress and anxiety amongst a refugee community. And Christine, I don't know if anyone knows Christine, but she's very well known in the refugee health community, and for her to say that sort of thing is quite significant. Housing stress is a big challenge for us, and a big challenge for the GPs because they're constantly being asked to do housing support letters. So to be able to finance that and make that sustainable, then we have to make an appointment for that. So that clutters up our appointment book a lot. Housing in Canberra is extremely expensive. Rental market is very hard to get rentals, and the rents are high. So it's very difficult for people who are on such low incomes. As I said before, there's a high turnover of staff and under-resourcing in the Red Cross. Our counselling service has a very long waiting time, and this has been identified by the GPs as a backward pressure, that there's a big mental health load on their appointments when they're seeing clients. And I think this currently is providing quite a significant stress for the medical staff at the practice. And our GP structure is that we have lots of fantastic GPs. We have 9 fantastic GPs, really committed GPs, because to work at our practice, it is a significantly lower wage for them than anywhere else that they work. And 2 of our GPs are associate professors at the ANU, and they come to Companion House and work for a lot less than they could work anywhere else. So we're very grateful to have them. They're a wonderful resource, but they do sort of go off long periods of time and do wonderful research things, or go off and do wonderful things overseas. And it can be difficult to try and keep a consistent level of appointments available to the clients. And as I say, this can then put some pressure on the nurses, because we have booked appointments, and we also are a drop-in clinic. So at times it can be quite chaotic in the waiting room, and that the nurses are the ones that see the clients when they come for that initial assessment and triage. So we are in the process of going forward with a new strategic plan for the service, because like other people have identified, we are expecting a big number of clients, new arrivals for us, that will be coming before June, and we are now about to sit down and just see how we're going to manage that situation from our very small perspective. We, as well as having new arrivals, we have a core of existing clients that have been with us for a number of years. Our mandate is to see everybody who has had a background in torture and trauma, and we would not move people out into the community general practices until we feel confident that they are able to manage that, and sometimes that can take a number of years. We also see anyone who's seeking protection, seeking asylum, who comes through our doors. So the new arrivals is only a proportion of the clients that we see. So we're trying very much to try and get those pathways into mainstream general practices, so that our clients can feel comfortable being transitioned out into other practices. But that is taking some time, but it's the opportunity, and it is starting to happen, which is great. And because I'm all about the money, it's all about we're trying to raise the income of the practice to maintain our sustainability, and to continue being able to provide what we provide. We became an accredited service just over a year ago, and that's made a huge difference, because we can now get practice nurse incentive payments, medical student incentive payments, etc. So all these things help enormously, but as you well know, a number of our clients don't have Medicare, so we can't bill those clients at all, and of course we want to see them. So that's been a opportunity / challenge for me this year, and that's all.